So the whole purpose of today is just to answer some questions, give you some information, and really take a big look at what we do as a group and a practice. By the way, I am to remind you that this is being filmed, but you're not in the video, so that's sad actually, because you guys look great. So we'll take pictures later. So who we are is my title, and I brought a special guest right here. He is a great listener, all right, and I did bring him from home. So before you think I'm really weird for having a skeleton in my house, I'll tell you a little story about him. So I actually got this guy for these two. So that's my niece, her name's Nala, and that's my nephew, Zane. So as a good uncle, I borrowed this for Halloween to really frighten them, traumatize these kids for life. But they didn't get afraid, and instead they gave him a name. So this is Spiny, all right? And so the beauty of Spiny is when we talk about different things, it's easy to look at the anatomy, it's easy to see what we're talking about compared to pictures. I remember when I was studying for injections and whatnot, it was hard to really visualize three-dimensional structures on a piece of paper. So let's talk about pain. So pain is an experience, it's an emotion, it's a feeling. It's been there through every culture, every civilization, every society. And pain has been used for many different things. Kings, emperors used pain as a weapon. They had all these different torture tools. The Romans were feared because of the pain they could inflict on their enemies. And today the athletes and philosophers use pain as kind of a marker of strength and persistence. So pain has had many different uses. For us as healers and treatment of pain, our job is to help eliminate pain or reduce pain. And that's where things get a little complicated. So in today's world, pain is considered a biopsychosocial issue. Confusing? Yes, it is. So what that means is you could have a problem in your body like a bad knee or a bad spine. And what happens is it affects you not only physically, but emotionally, and then pretty soon you're not hanging out with your friends, and so it causes social isolation. So pain is a very complicated problem and very difficult to treat. And throughout our society, we've had problems treating pain. And today, pain is the #1 reason people go to the ER, people are out of a job, people are suffering. So pain is a big problem in today's society. And if we look at all the treatments, opiates, they seem to be very helpful, but we didn't realize after the 1970s and 1980s that people would get addicted to this, dependent, and lots of deaths. So we had an epidemic. Limited treatment awareness is another problem. A lot of primary care doctors don't have a clue about what we do. If you have a patient that comes from a different facility, they don't know what an RFA or is ablation. You know more than most primary care physicians regarding pain and treatment availabilities. And the complex healthcare system, medial branches, 80%, let's write it, let's document it. That's a challenge, but a necessity in our world. Regulatory delays in care. The way the world works today is that a patient can come in. I had a patient this morning really upset that I was not going to do the ablation without a medial branch block. And these are the realities we live in that make it very difficult to treat pain. What we do is really evidence-based, meaning there's a lot of proof that it helps, ablations and epidurals, but there are a lot of people doing non-evidence-based treatments. You have back pain, we'll do an enema, and it's there in LA. They do these weird non-evidence-based treatments, and that's a big problem because there's a lot of misinformation out there in regards to pain and how pain should be managed. So is it all a lost cause? Shall we just give up, go home? So how do we treat pain? Well, let's realize that, we're one of the best healthcare systems in the world, right here in the US. Most countries, if you don't have money, you don't get treatment. My uncle had a heart attack, this was many, many years ago, in the south of Sri Lanka, and they didn't have a stent. He had money. They drove him 4 hours while he died. And that's very common in this world where people don't get the care they need. So we have an amazing healthcare system. Most countries, people don't get opiates, meaning if you have a knee surgery, you stay in the hospital a little longer or you go home and suffer. So we have opiates. Elective care If you want a knee replacement or an ACL done in most countries, you're going to wait 6 months to 2 years. Most Canadians come here because they can have better access to elective care. EMTALA, that's a rule saying that if you go to the ER, no matter who you are, no matter what happens, that they will evaluate you, they will make sure you don't die. Not there in most countries. So we have an amazing healthcare system, even though it does have its limitations and challenges, and that's one of the things that we should all realize. But the system is complex. Patients don't get this. And that's where our job comes in, to treat patients in this complex healthcare system, even though it's amazing, and make them realize that they are getting the best care there is. So the very first thing we do is understand that difference, which is, okay, so a patient comes in, we tell them, hey, listen, we get it, it's frustrating, but here, look, this is what we can do. Then the second thing we do is identify if it's acute or chronic pain, and that's a big deal. Acute pain is any pain that's been there for 3 months or less. It has a beginning, middle, and end. Those are the patients that get fixed, feel better. A broken knee, chest pain, you go to the ER, you have an option. Those pain conditions and those pain patients need to be identified. Now we deal with patients on this side, which is more chronic pain, meaning they've had pain for more than 3 months. They might do well for a while, but the pain will come back. It's typically episodic treatments. And so these patients, for the longest time, they didn't have any options. And most providers would do some injections, they'd do some physical therapy, they would do surgery. But finally, there was a plan. It's called the Multimodal Interdisciplinary Treatment Plan for Chronic Pain. Essentially, it means use many different types of treatments at the same time to help these patients. If somebody comes to see you in pain, there are many different types of medications we can give them. Muscle rehab is a huge part of this, which is strengthening the core, strengthening the back. Behaviors. If you're golfing every day, you may need to change your behaviors and behavior modification. Also, alternative treatments. There are some treatments that have a lot of evidence, like acupuncture, breath work, rest. And finally, direct treatments, which we're known for, which is the injections and direct treatments. So when somebody comes with chronic pain and they want a magic injection or a solution, it doesn't exist. This is the treatment plan. This is what makes the difference. And no one really does this right now. And we're one of the few centers that promote a comprehensive treatment plan using all these different things. So to give you an example, if somebody comes in with a pinched nerve, right? We have an L4 pinched nerve. If you look here, this is spiny from behind. This is the back. There are all these little muscles. They're called the multifidi. There's a mnemonic, and it's called I love spaghetti. Longissimus, iliocostalis, and spinalis. Those muscle groups run all along the back, and those are the first ones that get deconditioned or weakened. So if somebody has had pain for 3 or 4 days, right away the muscles are weakening. So even if I do an injection, if they don't go home and do the right exercises, okay, change their behaviors, take some medications to keep them comfortable during the acute stages, and manage their stress, the injection won't help. So that's why we push and promote this comprehensive treatment plan. And that's how we treat all our patients. And all of you play a role in this treatment plan. And all of you have different parts that help patients live happy lives. So we looked at the how. All right, this is when things get a little interesting. So we're going to look at the what, right? So we know how we fix it, but what do we do for patients? So what do we do? All right? So if somebody asks you, what do you do? Right? You probably say, I work in Eisenhower, I check patients in, I do pre-op, I'm a nurse practitioner, I'm a medical assistant. But really, let's kind of take a big look, a big, overhead look at that. Well, we have meetings, right? Meetings are important. So there's Marita sitting in a meeting. There's all of us in a meeting. There's Adam. We got Marianne. So meetings are a way for us to communicate ideas and kind of spread knowledge amongst us. We also work. We do a lot of different things. Education. And that was Jeff running down the procedure room with work. We're there for each other for the holidays, right? That's me eating a cake. So essentially, we've seen a lot of people come and go. So what do we do in this place for each other? Well, we have to support each other through the challenging process of what we do. Because we treat patients that are very difficult at times because they don't understand the system. And when we treat these patients who come in with different expectations, we have to manage the expectations, get them involved in the plan, and we see a high volume of patients. We do procedures that not many other facilities do here, and we're a successful place because of what we do for each other. We support each other, but even more than that, we do something for patients. So I, for whatever reason, since I was in residency, 2009, I don't know why, I've held on to every little piece of paper a patient ever gave me. So this is from 3 big boxes, right? This is the first layer of the boxes. And you can see all these notes, and there's tons more talking about how thankful they are and how happy they are for what you have done. So if anybody asks you what you do, that's what you do. You give patients hope, which is a very powerful thing. And this is a group of people who have nowhere to go. Pain patients come to us. If they go to the ER, they're treated like drug addicts. Opiates don't help them. The pharmacies treat them like, prisoners. This is not a group of people who can find help anywhere else. Primary care doctors don't know what to do. So when they walk into our buildings, that's the first sign of hope they've had in months and years. And that's a very powerful gift you're giving so many people. Now, you're probably thinking, it's all Dr. Cassim, and that's cool, that's fun. But let me tell you a story. I was in Costco, this is a true story. I was in the kind of that meat aisle, and a patient comes to me. He had gone to the ER with back pain, and he had picked up a prescription that hadn't helped him, so he came back to see if there are other medicines waiting for him, and there were not. So he pulled his pants down in Costco, and I'm kind of backing away from the guy because there's this naked man in front of me. Everyone's watching, and he tells me, what's going on, help me. So I tell him, hey, you've got sciatica, you've got pain going down your legs. And then he looks at me and says, what are you going to do for me now? Nothing. I can do nothing for somebody. And that's the part where we all play a role in this. Checking in patients, rooming patients, so that I have the information, ordering the MRIs, authorizing the procedures, and in the procedure side, helping get the patients on the table, doing an injection. So me by myself, I'm just a piece of the puzzle. But all of us together can do amazing things. So this is the place anybody with sciatica or back pain needs to be. And I would say this place would give them hope and treatment options better than anywhere in this world. And so that's something you should always remember and be proud of. You are amazing. All right, so we looked at the how, we looked at the what, and finally the why. So why do we do all this, right? Well, we do it because we have great outcomes, a lot of science behind what we do. But I'm going to play you a little video.
I'm Dave Livis. I'm 92 years old, and I originally came from Michigan, and I've been in the desert since 1989, and I've had pain since I came to the desert. I went to many doctors. I had therapy and this and that and the other. I found Dr. Cassim, and he was able to talk to me, and he knew what I wanted to do while I was living. I happened in May wanting to go to New York, and I was in pain. And I said, I have 6 great-grandchildren. I want to go see them. He says, well, let's see what we can do. and he gave me a shot. And here, I was right in New York, got to see plays, walked around, felt like a million. So I really, really praise Dr. Cassim because he listens when you have pain. Thank you. I think I'm probably one of Dr. Cassim's oldest patient. And so he's very, very kind to me because my children are very concerned and they always want to know what. And on the office, always will let them know. And it's been an easy, even though I can't walk like I would like to, but I'm free of that terrible, terrible pain. And the epidurals, or whatever he does, I don't question. Just do it. I want to walk. And he's been just wonderful helping me. And also his nurses always smile. And it's been a real, real nice way at my age to feel. They're just wonderful. In fact, I hate filling out papers. Every time I come, the same papers. So she said calmly, "It's okay, I'll take care of it." I hate that filling. It's the same thing every single time. What a waste of paper.
So that was from one of our conferences a while ago. Her name's Faye, right? So if you see that video, she doesn't care what we do. She just wants to get better. She wants to go see her kids in New York. Those are the people that are coming in. Those are the people you're giving hope to. And to get her into the room, you register into the complex medical system. We room her. You authorize the injections. Each one of us contributes to a piece of that. It's not just one person. And as a team, we make such a huge difference in people's lives. Now, Faye, this was done, I think this was a few years ago. Faye since passed away, and I actually, I went to a funeral, and all those grandkids were so thankful for that trip. And that's the beauty of what we do in pain management. We're not able to heal people. Everyone eventually, meets their maker, so to speak. But what we do is give people these moments. And there's a little saying that I'll end things with. And it goes, "May you be proud of the work you do, the person you are, and the difference you make." Thank you.